so I'm standing outside of my patient's room and I've just performed hand hygiene. Client's room. I'm going to perform hand hygiene once I enter the room with the alcohol-based gel, rubbing my hands until they're dry. Good afternoon, my name is Jocelyn. I'll be your nurse today. Can I get your name and date of birth?
Yep, Jamie, 8792.
Okay, today I'm going to be assessing your vital signs. Do you have any questions before I begin?
Nope.
Okay, so I'm going to start by taking your temperature. This is a tympanic thermometer. This will read in your ear. So I've already disinfected this, and I'm going to use a cap before using it on my client, turning it on. I just need to pull your pinna up and back. Is that okay with you?
Yep, that's fine.
Okay, and with this one, you just hold the button until it beeps. And you have a 97.2 temperature, that's awesome. And then I'm gonna discard the cap into the trash. Disinfecting this once again once I'm done. Next, I'm gonna go get your O2 saturation. So I'm gonna assess my client's fingers. They're not cold, they have great circulation. Which finger do you prefer?
We'll do the index.
Okay. Awesome. This will also get your pulse reading, but I'm gonna take a manual pulse reading later. Perfect, that's 99%, that's awesome. I'm also gonna disinfect this before and after use. So next I'm going to assess your apical heart rate and your radial heart rate to make sure that they are strong and equal. Do you have any questions before I begin? Okay. In order to do this, I need to locate my client's midline in the chest and move over to the left mid-clavicular area, and the perfect space to hear her apical heart rate is going to be in between the 4th and 5th intercostal. So in order to do this, I need to go under your shirt. Is that okay with you?
Yep.
I'll have you put your arm right here. I'm going to assess this for 1 minute. So both pulses are strong and bounding and equal. Now I'm going to count your radial pulse. I'm also going to assess this for 1 minute. Okay, your pulse rate is at 72, and without my patient knowing, I'm going to keep my hand on her radial pulse and assess her respirations just to get a better reading of the respirations without her altering her breathing. Okay, your respirations are at 18 per minute. And next I'm going to take your heart or your blood pressure. So while taking blood pressure, it's super important to make sure that your client doesn't have any clothing that's going to obstruct the blood pressure cuff. I'm going to make sure that the blood pressure cuff is 1 inch or 2 fingers above the antecubital fossa and lined up with the artery. I'm also going to make sure that my cuff is snug but not too tight, not too loose. Is that comfortable there for you?
Yeah.
Okay. So I'm going to palpate her brachial artery just to find a good pulse, and that's where I will put the diaphragm of my stethoscope. So your reading was 128 over 80. Is that within your normal range?
Yeah.
Okay. Also, while assessing blood pressure, I'm also going to make sure that my tubing doesn't touch anything to obstruct any sounds or add any extra sounds. So last thing I'm going to do is assess your dorsalis pedal pulses on the tops of your feet. I'm just going to remove your shoes.
Excuse the dirty feet.
So in order to locate the pedal pulses on top of the feet, to locate them, it's in between the great toe and the second toe. Will you just put your feet out? And run your fingers along the top of her feet, and you'll find her pulses about here. Super important to use 2 fingers to increase your surface area and not to push too hard, not to occlude that pulse. So I'm going to assess this for 1 minute as well. Okay, so your pulses are strong, bounding, and they're equal on both sides. Do you have any questions about your vitals before I get out of the room? Do you need anything before I leave?
No.
Okay, so I'm going to make sure and sterilize all the equipment that I've used on my client today. I'm going to perform hand hygiene with the gel before I leave the room, and once I leave the room, I'm going to perform actual hand hygiene.